This video is for general education only. It is not medical advice. Treatment suitability, risks, regulations, and results vary, so always consult a qualified medical professional.
Korean clinics can make one treatment menu look like 50. Here's what every major option actually does.
This guide covers clinic treatments, not home skincare or plastic surgery, and groups different brand names by what they actually do.
Think of the menu as a ladder. Facials work near the surface, lasers target specific skin problems, needles trigger repair, injectables place material, and energy devices heat deeper support layers. The correct starting point is not the trendiest machine. It is identifying whether the problem is oil, inflammation, pigment, scarring, dryness, or laxity. A consultation should also check medications, active infections, pregnancy, recent tanning, previous procedures, scar history, and skin tone, because the same setting is not safe for everyone. The gentlest category is the basic clinic facial: cleansing, mild exfoliation, optional extraction, hydration, and a soothing mask or light treatment. Aqua Peel, Hydrodermabrasion, and similar water-based facials combine light exfoliation with suction and fluid delivery. They mainly provide temporary smoothness, cleaner-looking pores, and surface hydration. It can make pores look cleaner, but it cannot permanently shrink them, erase deep scars, or rebuild a weak facial structure. Chemical peels use controlled acids to loosen damaged surface cells. Depending on the formula and depth, they can address congestion, uneven tone, rough texture, or fine lines. Superficial peels are the common maintenance version. Expect mild stinging, temporary redness or flaking, and usually several sessions instead of one dramatic transformation.
Medium and deep peels remove more tissue and require substantially more healing. They should never be treated like a casual add-on, especially when pigmentation or scarring risk is higher. Microdermabrasion mechanically polishes the outer surface instead of dissolving it with acid. It can brighten rough skin, but it remains a shallow treatment. LED therapy uses non-invasive visible or near-infrared light. Blue and red light may support some acne plants, while red light is commonly used as an adjunct, not a replacement for proven treatment. Dual-frequency ultrasound, often called LDM, is marketed for calming and hydration. Early studies are encouraging, but its evidence base remains smaller than established acne treatments. Cooling devices, sheet masks, oxygen sprays, and modeling masks mostly reduce discomfort or temporarily improve hydration. Their role is recovery and experience, not structural transformation. But once acne is inflamed, a relaxing facial is no longer the whole answer. Professional extraction uses sterile instruments to remove selected blackheads and whiteheads. It clears existing blockages, but prevention still depends on an ongoing acne plan. Aggressive squeezing can push inflammation deeper, injure surrounding tissue, and increase discoloration or scarring. More extraction is not automatically better. For a large, painful cyst, a dermatologist may inject a small amount of corticosteroid to reduce inflammation quickly. This treats one urgent lesion, not the cause of recurring acne. And this distinction matters. Active acne, leftover red or brown marks, and permanent indented scars are three different problems, requiring different tools.
Light-based treatments divide into two families: broad-spectrum IPL and true lasers, which deliver more specific wavelengths to selected targets.
IPL can address combinations of redness, visible vessels, and superficial sun-related pigment. Because it spreads multiple wavelengths, it may cover several concerns, but usually requires a treatment series.
Vascular lasers target pigment inside blood vessels. They are used for visible capillaries and persistent redness, not clogged pores or depressed scars.
Pigment lasers can break up selected brown spots, freckles, or some birthmarks, but an unexplained or changing spot needs medical diagnosis before anyone tries to erase it cosmetically. Laser toning usually means repeated low-fluence passes from a Q-switched laser, commonly used in Asia for diffuse pigmentation and melasma. Low energy does not mean zero risk. Excessive accumulated treatment can cause rebound darkening or patchy pigment loss, and melasma may return after an initially good response. Picosecond lasers release extremely short pulses that fragment pigment and can create microscopic tissue effects when used with specialized fractional lenses. Pico describes pulse speed, not a guaranteed result. It can treat certain pigment and texture concerns, but it is not automatically superior for every patient or every type of melasma. Melasma is especially difficult because pigment is only part of the condition. Heat, light exposure, hormones, inflammation, and recurrence can matter, so combination management usually beats chasing it with stronger lasers. Pigment can fade. A true indented scar requires the skin's structure to be remodeled.
Scar shape determines treatment. Narrow ice pick scars, sharp-edged boxcar scars, and broad rolling scars behave differently because each involves a different depth or attachment pattern. Traditional microneedling repeatedly inserts fine needles at controlled depths. The resulting micro-injuries activate wound repair and new collagen formation, gradually improving some scars and uneven texture. Microneedling commonly requires multiple sessions and weeks to months of remodeling. Deeper needling is not automatically better and can increase complications. Radiofrequency microneedling adds electrical energy through needle electrodes, creating controlled heat at selected depths. That combines mechanical needling with thermal remodeling for texture, scars, or tightening. This is a medical procedure, not a stronger facial. In October 2025, the FDA warned of reported burns, scarring, fat loss, nerve damage, and other serious complications with certain RF microneedling uses. Fractional lasers treat microscopic columns while leaving surrounding skin between them. Those untreated bridges support healing, allowing meaningful resurfacing without removing the entire surface at once. Non-ablative fractional lasers heat tissue beneath an intact surface. Ablative fractional lasers remove tiny columns of tissue, generally trading greater resurfacing intensity for more recovery and risk. Fractional CO2 and erbium lasers are common ablative options for acne scars and photo-damaged texture. Results and downtime depend heavily on wavelength, density, depth, energy, and aftercare. Subcision addresses rolling scars from underneath. A needle or small blade releases fibrous bands tethering the scar downward, allowing the surface to rise as healing occurs. TCA CROSS places high-strength acid only inside selected narrow scars, triggering localized reconstruction. It is mainly associated with ice pick scars, not full-face peeling, and requires precise placement.
That is why severe acne scarring often needs combinations: subcision for tethers, cross for narrow pits, resurfacing for edges and texture, and sometimes filler for remaining depressions. Skin booster is an umbrella term, not one treatment. Clinics use it for shallow injections intended to improve hydration, texture, elasticity, or recovery, rather than reshape the face. Hyaluronic acid boosters place small amounts of water-binding gel within the skin. They may improve hydration, radiance, and fine surface texture, but they provide less projection than conventional filler. Polynucleotide injections, sometimes marketed with salmon DNA language, use purified DNA-derived chains. Small studies suggest skin quality benefits, but formulations differ, and the evidence is still developing. PRP starts with the patient's own blood. After centrifugation concentrates the platelets, the plasma is injected or paired with needling. Studies suggest modest benefits, especially for texture. Exosomes are cell-released signaling vesicles, but the word alone reveals little about their source, purity, dose, or manufacturing. In the United States, no exosome product is FDA approved. So never buy a booster by nickname alone. Ask for the exact substance, injection depth, regulatory status, expected benefit, and plan for complications. Botulinum toxin does not fill wrinkles. It temporarily reduces signaling between nerves and selected muscles, softening expression lines created by repeated movement. Approved products carry serious safety warnings. In the lower face, Masseter injections can reduce an enlarged chewing muscle and gradually narrow a muscle-heavy jaw. They cannot make a wide jawbone smaller or remove facial fat. Dermal fillers place material to restore volume, soften folds, support contours, or enhance features. Hyaluronic acid is common, while other fillers use substances such as calcium hydroxylapatite or poly-L-lactic acid.
Filler complications range from swelling and nodules to accidental blood vessel blockage. Rare vascular events can cause tissue death, vision loss, or stroke, making anatomy and emergency preparation critical. Collagen stimulators are slower. Materials such as poly-L-lactic acid and calcium hydroxylapatite can provide immediate support, delayed collagen stimulation, or both, depending on product and technique. Fat-dissolving injections damage selected fat cells. In the United States, deoxycholic acid is approved only for adult fat beneath the chin. Unapproved mixtures and other locations carry additional uncertainty. A slimmer-looking face may require muscle reduction, fat reduction, structural support, or none of them. Treating the wrong compartment can create imbalance instead of harmony. Micro-focused ultrasound, often called HIFU on clinic menus, concentrates sound energy at selected depths, creating small thermal zones beneath the surface that stimulate a gradual tightening response. Radiofrequency uses electrical energy to generate controlled tissue heat. Monopolar, bipolar, and multipolar systems distribute that energy differently, so identical-sounding RF treatments may reach different depths. Ultrasound and non-invasive RF usually produce modest, delayed tightening, not a surgical facelift. Results depend on anatomy, device, settings, operator, and realistic patient selection. Thread lifts insert absorbable barbed sutures beneath the skin. The barbs mechanically reposition selected tissue while healing forms around the threads. The immediate lift is usually the main visible effect. Threads can cause swelling, dimpling, asymmetry, infection, visibility, or extrusion. Reviews find short-term improvement, but long-term evidence remains limited, so they should not be sold as surgery without surgery. Before combining treatments, ask what each step adds, which layer it targets, how recovery overlaps, and whether complications could become harder to identify. More procedures do not guarantee better results. K-beauty treatments make sense once you match the problem, tissue depth, and evidence. Choose diagnosis over trends, and qualified care over the cheapest package.